歡迎各位嚟到。
Welcome to today's COVID-19 media briefing. For the speakers today, Dr. Choi Taki, Undersecretary for Food and Health, Dr. Chung Shuk-Kwon, Head of Communicable Disease Branch for Center for Health Protection, Dr. Linda Yu, Chief Manager, Clinical Effectiveness and Technology Management of Hospital Authority. Undersecretary will speak first. For the speakers today, good afternoon, friends of the media and the members of the public. The COVID-19 pandemic situation in Hong Kong persists. On the 30 days from 24th of December to December 30th, Hong Kong recorded a total number of 425 cases, of which 395 were local or local linked cases. Untraceable cases made of 36%. Over the past week, which is 31st of December to January, 6th of January, we recorded a total of 296 cases. 268 of those were local or local related cases, 27% of which were untraceable cases. Over the past 2 weeks, 26% of those local cases were asymptomatic. Even though the recent number of cases have been declining, the government will continue to appeal to the public not to organize or take part in unnecessary gatherings and to avoid staying in crowded places and must wear masks at all times and avoid staying in crowded and poorly ventilated areas. If the whole society let down their guard on anti-epidemic vigilance, they will add to the risk of a rebound. Continuous virus testing and compulsory testing for high-risk groups and buildings are necessary anti-epidemic measures. In order to cut off silent transmission chain in the community, the government has expanded the scope of compulsory testing. The government is grateful of the public cooperation with the compulsory testing notices. Currently, compulsory testing subjects can choose from any of the 6 testing methods. Mobile specimen taking station is just one method. The government shall continue to monitor the utilization of these stations and the public testing demand before deciding whether to set up more mobile testing stations and to extend their operating hours. The general public can also do their compulsory tests at community testing stations, and the compulsory testing subjects are not required to pay at these community testing centers. And they also make advanced bookings at the website www.communitytest.gov.hk. Compulsory testing subjects can also consider another free testing method, that is, collecting deep throat saliva sample kit from automatic vending machines at 121 post offices and 20 MTR stations, or request the specimen kits at 47 designated general outpatient clinic of Hospital Authority. I would like to explain to the compulsory testing subjects of matters to note when conducting deep throat saliva tests. Currently, the public will receive an enhanced specimen kit at post office, MTR stations, and Hospital Authority clinics, which is the one I'm holding up. Inside the specimen kit, what does it contain? A test tube containing a small amount of viral transport medium, a paper funnel, an information sheet on deep throat saliva selection, and a testing form. The collection bag and the test tube have been labeled with a barcode. This will facilitate tracking and allow for more accurate and quicker access through the computer system in sending the negative test result via SMS to the public for record keeping, and would offer the public extra peace of mind. Generally speaking, the public will be notified via SMS 3 days after submitting their sample. I must stress that again that the Department of Health will directly contact the positive testing subjects and initiate follow-up. On the testing form, you should fill out your personal particulars, for example, ID number, your name, and a telephone number which can receive an SMS. And please check the information before you submit your specimen kit. And this specimen, and make sure the information provided is accurate and complete. The compulsory testing subjects, should they prefer to get tested at their private laboratory or through any other ways, and please inquire beforehand that whether they will provide an SMS result notifications. The government has set up a website, www.ebt.gov.hk, to facilitate the public to check and download the electronic testing records. From 21st of December, 2:30 afternoon of last year, the public have started to receive the negative results notification from Department of Health, the Hospital Authority, and the community testing stations. And you can also access the website of the system, www.ebt.gov.hk, input your ID number and the barcode number to download the electronic testing record. This website will provide another way to check the testing results. Thank you all. Dr. Chuang. And last night we have confirmed 33 cases. The case number is 9076 to 9108. Of the 33 cases, which include 15 men and 18 women, aged between 4 to 81 years old. We have around over 30 preliminary positive cases. Of the 30 cases, which include 4 imported cases and 29 in local cases, which are included 5 untraceable cases and 24 linked cases. For the 4 imported cases, which included 1 arrived from Nepal on the January the 5th, arrived on RA409, 1 arrived from Pakistan via Dubai on flight EK384 and arrived on the 5th of January. Of the 29 local cases, besides the 5 untraceable cases, the other 24 cases, which are linked to early cases, which include 11 a case related to Chungkang O Lamtin clusters, and 9 of which are close contacts and 2 workers. These 11 cases were sent from or confirmed at quarantine centers and sent to hospital. The 24 local cases, 18 of which were confirmed at quarantine centers. The other 13 cases, besides the 11 cases related to the tunnel work site, the other 13 cases are linked to other earlier cases. The Chungkang O Lamtin tunnel tally is 15 workers and 12 close contact, 27 cases in total. And that's the end of today's report.
Dr. Yu, please. Good afternoon. As of 9 a.m. today, in the past 24 hours, the HA has reported a total of 37 cases. And in the past 24 hours, 57 confirmed patients have been discharged. Up to now, 8,257 confirmed patients and 1 probable case have been discharged. Now, 633 patients are currently hospitalized at 23 public hospitals in the AW Community Treatment Facility. 41 are in critical condition, 47 are in serious condition, 542 are in stable conditions. The number of negative pressure beds is 1,261. Utilization rate 59.8%. The number of negative pressure is 691, and the utilization rate is 70.6%. On the 5th of January and PMH, we have set up a mobile specimen collection station for colleagues. As of last night, close to 1,200 persons have got tested there. And together with the tests done at hospitals, over 1,500 colleagues have been tested. Among those tested, there is one preliminary positive case. And this colleague is a service assistant of the occupational therapist therapy section, and he had cough and sore throat. And on the 6th of January, and he sought medical treatment, and then he is tested preliminary positive. He is assisting occupational therapists to provide treatment. He doesn't have to be involved in high-risk procedures, and during work, he has also worn appropriate PPE. The hospital has conducted contact tracing. This colleague has had meals with 3 colleagues, and they are considered as close contacts to be quarantined. We also know that this colleague has family members who are feeling unwell, and they are also preliminary positive cases. In also the medical day ward where infection is found, there is no new case. For the 243 subject to compulsory testing, over 200 have been tested, and the remaining will get tested as soon as possible. As for the radiologist, initially confirmed at Tuen Mun Hospital yesterday, when we conducted contact tracing, we found a support staff who was considered a close contact. This colleague is responsible for cleaning the toilets used by the colleague, and the worker didn't wear face mask, so the person has to be quarantined. So the floor is open to questions. Please state your media organization. The first person on the second row. I'm from Cable TV. First of all, Dr. Cho. There will be a command center to be set up in Kai Tak, it is said. How many people will be helping out in the command center? And as for tracing the close contacts of close contacts, when will the plan be implemented? Do you have a timeline to share with us? And if that is done, who will be the priority groups? Are the household members of the close contacts, or the colleagues in the workplace of the close contacts? Will they be asked to get tested on a compulsory basis, or are they required to stay at home before their test results are available? And for Sinovac vaccines, right now we don't have the phase 3 clinical data yet. So would there be a delay in the vaccination program? And there are 5 untraceable cases today. Dr. Chong, who are involved in these 5 cases? Are these people who come into close contacts or frequent contacts with members of the public? Thank you. Let me briefly talk about our plans to enhance the tracing of close contacts. And then Dr. Chang will also supplement in a minute. We know that contact tracing is a very important measure in fighting the epidemic. We hope to be able to identify cases as soon as possible. And if there are many cases, a lot of manpower is required to do liaison, to make inquiries, and to arrange for hospitalization of patients. So we need more manpower to help us. And the Chief Secretary for Administration is heading an interdepartmental committee to look into the matter. And we need more office space for the enhanced manpower. So we need to find bigger location. And on the question of vaccines, the government has announced that there are 3 types of vaccines to be procured. The earlier the registration of the vaccines, the better, because the vaccines will help cut down on transmission. But then we have to consider 2 prerequisites. The vaccines have to be administered on as science-based evidence. And the vaccine advisory panel will make sure that the vaccines come with good scientific data. And we also need support measures. If a large quantity of vaccines arrive at Hong Kong to be administered to a lot of people, the arrangement has to be very meticulous. This includes the delivery process, choice of venues, and the staff helping with the vaccination. So the government has been taking forward the work in these areas expeditiously. Once the vaccines are ready to be administered, we will make the announcement soonest. As for the center at Kai Tak, the community center at Kai Tak will be the venue to put in the command center. Disciplined services staff will help us out. So we've identified a location initially. Next week, around 1,000 officers from disciplined services will be seconded to our team to help contact tracing. And if the number of cases increases or decreases, the number will be adjusted accordingly. We will provide them with some training as well. For the 5 untraceable cases, these include retirees, 2 retirees, 1 who doesn't have a job now, and the other one is a worker at Tuen Mun Hospital, as pointed out by Dr. Yu, and also a cleaning worker. Sorry, the speaker is not coming through. We don't have a plan yet. If you are a household member of a person that needs to be quarantined, then I would suggest that these family members watch out for their own health conditions, because possibly the one quarantined will become a confirmed case. So we suggest that these household members would be watching out their own health condition and be tested as soon as possible. Economic Times. On contact tracing, Professor Yuen Kwok Yong earlier said that 10,000 officers from disciplined services be mobilized, but you said just now that there are going to be only 100. How come the big difference? And what is the division of work between the CHP and the disciplined services staff? Will there be PPE for these contact tracing staff? And also a question on vaccination. Do you have plans to set up a vaccination center in the 18 districts? Can you elaborate? Will members of the public know which vaccine will be administered at which community center? And what about Foshan and AstraZeneca vaccines? When will they arrive? What are the priority groups? And then for the Fong Chat House, the sewage samples have remained constantly negative. Is it the case that you haven't been picking up on all the infected cases in the first round of testing?
On the contact of the trace of close contact, currently we are using telephone calls. For the vaccines, On the vaccination centers, the government have noted the different characteristics of each vaccine. For the BioNTech mRNA vaccine, require a ultra low temperature for storage and very stringent transport requirements, and also complex requirements on defrosting and diluting. Thus, the government sees as necessary to concentrate the vaccinations at the community vaccination centers for easier coordination, as well as to reduce the chaos caused by setting too many centers. At least one vaccination centers will be set up in one district to deal with this vaccine, which is quite demanding in terms of logistic and defrosting. For the Fengchak House sewage samples, and this building is found in the Hong Kong U sewage study that with some positive sewage samples were detected in the building with no cases. That's why we've ordered compulsory testing for the residents. After completing the first round of testing, a few days later we found that positive samples were still found in sewage samples. We've discussed with the Hong Kong U and the experts, which they speculated that even though most of the residents were speculated, or maybe at around over 90% of the residents, at the first round of testing, they may not have their onset or a very low viral load. And now that the viral load has increased and managed to be picked up, therefore we need to order another round of testing. Speaker not on mic. Next question. This gentleman.
Can I first ask you about the sewage sample in Fengchak House? Because you said that one of the reasons the experts have guessed is that some of the patients have not got their viral load up yet at their first test. Could it also be the case that some people have not followed the mandatory testing order and therefore have not been found as patients before? And will you set up a checkpoint, just like what you've done with other estates before, to ensure that everybody has complied with the order? And do you have any figures of how many people have not complied with mandatory testing orders so far? And secondly, about the vaccines. Sinovac has yet to publish its third stage data, and it could be that they would release their third stage data in Brazil, maybe 11 or 12 hours later. But there's also speculation that it could be postponed yet again. And if that is the case, what does that tell you about the effectiveness of that vaccine? And does the government have any backup plan to ensure that its timetable to roll out vaccination by February would not be derailed by that? For example, will it vaccinate people using Pfizer and other vaccines first? And how do you restore confidence in the Sinovac vaccine? Yeah, that's all. Thank you.
Mm-hmm. Well, about the Fengchak House sewage surveillance program, and also the result of the need to carry out compulsory tests, we have checked the number of or the percentage of compliance with the first round of compliance tests is really quite high. It's more than, roughly remember, it's more than 95%. So, so with consultation involving the experts and also the study group, they propose, of course, there's no confirmation scientifically, but their proposal is that the more likely reason is perhaps some of the individuals who have been tested may have a very initial stage in the illness, so early that they are shedding very little amount of virus, so it's not detectable. So perhaps with time, the viral load will increase, and that's why the sewage surveillance showed a positive result after a negative finding for several days. So that is their suggestion of doing a second round of compulsory testing for that building. Of course, hopefully we can find some positive cases which may stop the spread of the disease in that area or to other areas as soon as possible. And for vaccine, I think the government, of course, would try our best effort to obtain scientifically proven, effective, and also safe vaccine for the people of Hong Kong. And of course, there are two dimensions that we are addressing concurrently. One is the legal aspect, because the company has to apply for emergency use on the basis of the 599K regulation, and of course with the backup of the scientific advisory panel who would vet very closely the scientific evidence, the safety data, and also all the information available or requested to be supplied by the manufacturer. And the other dimension is the mechanism in providing the vaccination. As I've explained before, if we are going to launch a large-scale vaccination program, we need to prepare very carefully the location, the logistics arrangement, especially for BioNTech mRNA vaccine, which requires a very special low temperature storage, and also the dilution requirement, the thawing requirement. And of course, we have to establish a large enough number which is big enough to cover different districts of Hong Kong, and also the number of healthcare personnel which will be required to station at those centers for administration and also for aftercare. So we are doing those preparations very closely.
好，下一位嗰位女士嘅第二行。
Played in the second row. Now news. A question for Dr. Chuang. Just now you mentioned that the CHP will train the disciplinary officers for telephone contact tracing. However, it was reported in the past that some people refuse to take their calls or didn't pick up their phone, thus didn't send to quarantine camps. And do you see that it is possible that the discipline officers will need to make door-to-door visits to pick up consignees? And for the Fong Chek House sewage samples, do they have a high or low viral load? On the first round of compulsory testing, how many confirmed cases have you located? Currently, we have a small amount of disciplinary officers deployed at the CHP to track down close contacts. Sometimes the wrong phone number could be wrong, or we couldn't locate the cases. Then we'll enlist the help of the disciplinary officers. Sometimes they will help locate the cases by making home visits. And if we have more manpower, I won't rule out they would need to visit at their home. Well, first we would prefer calling them because they will not be at the workplace or at home.
For the cases at Fong Chek House, when the initial decision for mandatory testing was made, we saw that there was virus in the sewage pipes, even though there was no confirmed case then. I don't have the viral load back then, but they stressed that it doesn't matter whether the viral load is high or low, but whether the virus is present in the sample or not matters more. So that sends an alarming signal to us, telling us maybe there are potential cases. So we did the mandatory testing and identified several cases. This is a good example to show that we can actually use sewage samples to help us with tracing work. We can collect sewage samples for tests. And to help us to see if we need to take further action. Now, in the case of Fung Chek House, and if there are confirmed cases within the building, but then the team found that there might be buildings nearby where there has not been any infection case, and maybe sewage samples can be collected to just to make sure, then that can also be done. Another question. The second back row, the second person. I'm from TVB. The first question. You said that some 40 plus buildings were subject to mandatory testing, but then 15% of the residents didn't take the test. Will the administration take these people to task? How would you do that? And for these 70 plus buildings, do you have the latest figures on the testing? How many confirmed cases or positive cases have you identified? Second question is on Fung Chek House. You said that sewage samples were still constantly tested positive, hence the second test required. So do you have any idea or criterion to go by as to say when the samples tested negative for a certain period, then mandatory testing is not required? You said that some 95% people have tested. Would you be tracing the remainder? There are suggestions that the social distancing measures will be kept until the infected figures come to a single digit or even to 0. Let me answer the third question first. For eateries and specified premises arrangement, the government will consider the characteristics of each wave of epidemics and will also take reference from the results of the relaxation and tightening measures before we make further decisions. The government stressed many times that different from the third wave, the fourth wave has seen a high infection figure continuously for a long period. So we have to be very prudent in deciding whether to relax the restrictive measures. We understand that the operators of the specified premises are having a tough time. We understand that, but we have to strike a balance. If we relax the measures too quickly, there might be a resurgence of the epidemic. As for the drainage pipes, according to the team from the university, their emphasis is not so much on whether the sewage samples test negative. They will be looking at the common drainage pipes in the block. And on site, actually, when the team saw that there was a building with infections, but then they saw that there was a high possibility of cross-infection with another building. So they tested the sewage samples of another building, and that's why they, in the end, they found several sewage samples testing positive, and hence the suggestion to have mandatory testing for that other building as well. Now, for several days in a row, the sewage samples did test negative, and afterwards, the samples tested positive for 3 days in a row. So if they found the samples testing positive for 2 days in a row or for 2 days in a row of 3 days, then that's a concern for them, and follow-up action has to be taken. So the government has taken heed of their advice and made the decision that a second test be also mandated. Your second question, I forgot the second question. Yes. That's the initial estimate of the Home Affairs Department. But then the records might not be full or very comprehensive. Some residents might opt to take the test in the temporary testing center or even other avenues. So they've been carrying out matching of the data continuously, and they will further consider how to further enforce the law. We will continue to appeal to the residents to take the tests. And like I said in the beginning, those subject to compulsory testing have different avenues to get tested on top of the mobile testing station. I hope that residents can complete the tests as soon as possible.
English News. First question to Dr. Chuang. You have said next week there will be disciplined service officers such as police helping to trace close contacts. Can you tell us how many officers will be involved and what are the trainings about? Will they be given power to get in touch with suspected cases in person? And second question to Dr. Cho. We can see many overseas countries got low vaccination progress. Has the government set any targets, such as how long will it take to give the jabs and how many were targeted to get vaccinated in the first month? And how confident are you towards efficient vaccination progress, as the public may not have 100% confidence towards the vaccine's safety? And the last question to Dr. Yu, about one more tested positive in mass testing in PMH. Do you see him or her got infected in the community or within the household? What is the risk of transmitting the virus to patients during work? Thank you.
張醫生。
Okay. Around 100 officers from the disciplinary force will come to work in the Kaita Community Center to help with the contact tracing work of the confirmed case. We will give them briefing and then we will provide on-the-job training because the training may involve actual working under supervision.
For the vaccination program, the government has been very closely preparing the launch of the vaccination program. So through legislation and for the emergency use of a vaccine which is developed within a short time for the need of perhaps the world, I would say, because the epidemic is affecting many other countries all over the world. And concerning confidence, I think that has to be built up through various means. First of all is through education, because vaccination has been a very long, effective measure in controlling many infectious diseases. And of course, vaccines have their indication, contraindication, and every product has its own side effects or potential side effects. So I think we have to educate, and the government will try very hard to educate the public and also various sectors like the healthcare sector about the necessity of this vaccine and the precaution and the knowledge which is up to date. And the second point, I think, is through observation of the vaccination experience of other countries, of the vaccines that has been launched already. Of course, Department of Health and also, I think, the advisory, expert advisory panel and also the two scientific committees under CHP will watch very closely and also have official connection with the relevant authorities to understand or to know the updated information on especially serious side effects so far happening in different countries after administration of the new vaccines for COVID. So I think it's a continuation process. Confidence has to be built up through education and continuous information sharing, because it has to be transparent for people to be confident. And of course, the administration pathway in the local community is also important. We have to set up enough venues. We have to arrange healthcare professionals to do administration, and have to be provided with after a fully informed consent process. So that is the basic mechanism how we would try to administer the program effectively, efficiently, and also gain public's confidence.
Regarding the supporting staff who was tested preliminary positive at the mobile station set up in Princess Margaret Hospital, she is the supporting staff working in occupation therapy department. She developed symptoms of sore throat and cough and attended staff clinic on the 6th of January. And her main duty is to help the occupational therapist to conduct therapy for the patients and also to make pressure garment, etc. And she didn't require to do high-risk medical procedures, and she wear appropriate PPE during her work. We understand that she has family member also have symptoms prior to hers, and also tested preliminary positive. And I think the hospital is still investigating the source of her infection.
紅色衫最後。
And the last row. Oriental Daily News. For contact tracing, besides the police, which other disciplinary departments will be engaged? Would the CHP send a medical staff to the command center? And what kind of training will be provided, and how you predict the effectiveness? On tracing the close contacts with the close contacts, would they require to get tested? And can the public and private laboratories able to cope with this testing demand? Why you decide to emulate the mainland practice of tracing close contacts when the condition has improved? That instead of at the beginning of the outbreak, you will see that you're acting behind the clock. The disciplinary officers will include the police, the immigration department, and the custom excise department. We do not tend to dispatch all of them to make house visits, but if necessary, they'll be wearing a full PPE gear. Well, currently, we'll have enlisted the police or the immigration or the customs officers for help. For the contact tracing initiatives, well, we see that as important, but it's not the only thing that we need to strengthen and enhance in our anti-epidemic effort. We are constantly reviewing for any room for improvement. We need to pull more manpower or provide training for future contact tracing. I would see that as the right time. If we start training now, even though the pandemic has somewhat mitigated, if we have enough trained personnel, in case of a rebound where we have more cases, the contact tracing will be more effective if we have more manpower. On the third row, in green. In beige, or the person next to him. HKO1. A question for Undersecretary Choi. Recently, we see there's the mainland pandemic has fluctuating as witnessed in Hubei, and there are also sporadic cases in other cities. For Hong Kong, what's the risk of the mainland cases spilling over to Hong Kong? If there are cases imported from Guangdong, Will the return to Hong Kong scheme need to be reviewed or strengthened? Would the administration consider repealing the exemption? Another question is on vaccine. In the UK, in view of the pandemic, they decided to extend the time between the 2 doses. For the 3 type of vaccine Hong Kong procured, would 2 doses be required for all of them? If there's a rebound, we need to emulate the UK in lengthen the time between the 2 doses. And for scientifically and health-wise, is it possible? And for the pandemic situation outside of Hong Kong, the CHP have always been constantly monitoring and would timely adjust with the immigration or testing or quarantine arrangements. For the recent rapid increase of cases in Hubei, and the Department of Health have also announced new measures on the Jan 5th. In different mainland cities and provinces, the discovery of cases, if the Hong Kong resident had been to the places in the past 14 days, they would need to get tested at the boundary control point. From the January 6th onwards, if the Hong Kong residents have been to Hubei province in the past 14 days, upon their return to Hong Kong, they would need to get tested as well. For immigration control, especially on preventing the import of cases, the government will jointly review with the CHP on when to adjust the immigration restrictions. And third question on vaccines. When procuring these vaccines, one of the key sources of information would be the dosage and the timing information provided by the manufacturer. And for the execution of the details beyond this, we'll leave it to the expert advisory panel to decide. AM730, a question on the vaccine. For the Sinovac and Fosun vaccine will be arrived in Hong Kong. So which are the groups will get priority, and can they choose which brand? And you mentioned that there will be 18 vaccination centers, and would the public be able to know what brands there will be? And do you have a timetable for the launch of the makeshift hospital? The Kai-Tak Command Center, besides the 100 disciplinary officers, would other government departments able be deployed? Do you have a breakdown of other departments? Why is this there's the 100 strong is quite far apart from the 10,000 staff the Yun Kwok Yung proposed? And what is the division of work between that command center and the CHP? Besides Fong Chak House, did the Hong Kong U study team manage to identify buildings without cases? And do you have the case number for the untraceable cases?
Dr. Che, I'll take 2 questions, one on vaccines. On the locations for vaccination, as I explained, we will also be looking at the characteristics of the vaccines. The choice of community centers as vaccination centers is based on the consideration that one of the vaccines requires an ultra-low temperature environment to be stored and to be transported and so on. So the government has to act as a central coordinator to preempt any chaos. For vaccines requiring having high requirements in terms of delivery, storage, and so on, will be administered at government centers. for other vaccines, which are similar to, say, the flu vaccines, which have relatively simple requirements, and that is they can be stored at ordinary clinics, then they can be administered at a lot more locations. As for the case relating to the Fung Chek House, the team will make some observations on buildings with a lot of infection cases, and then they will make a decision on whether to test the sewage samples in the buildings nearby. This is a decision made by the team. Dr. Zhang, for the 5 cases, the number 9081, 9082, 9084, 9098, and 9108. For the Kai-Tak Command Center, some healthcare staff will also be stationed. For example, for certain works like issuing the compulsory testing orders and for other works which are related to healthcare work, then we have to be responsible. The government has shared some initial plans and views. The scientific committee has taken reference from the practices in other places, as for example, WHO's practices. Priority has to be set for vaccination. For example, if they are elderly, they are the chronically ill patients and those who have a high risk of exposure, and for those who can infect vulnerable people because of their work nature. So these will be the priority groups. So we are talking about chronically ill patients, healthcare staff, and those working in, say, residential care homes for the elderly and other handicapped people. Let's take 2 more questions. This lady first. I'm from RTHK. First question on vaccination. Fosun Pharma hasn't got the clinical data report. Do you know why? Or rather, the Sinovac Biotech hasn't come up with the clinical data report. Have you given them a deadline for submitting the report? Or is it the case that you are being very passive and you are just, there's nothing you can do but wait? And second question on Fung Chek House. If there are consistently positive samples, does it mean that there are hidden transmission? Would you be doing what like you did in Yutming Estate, that people have to present the negative reports before they can get in and out of the building? You said that the 4th wave will slow down more slowly than the 3rd wave. So does it mean the administration will cancel some celebrative events for the new Lunar New Year? Sinovac Biotech hasn't released the 3rd phase report, but Hong Kong, the relevant departments in Hong Kong will liaise with them closely, and safety is our top consideration. And the expert panel will be reading or looking at the 3rd phase report. So we'll have to wait. And we are also liaising closely with them to understand what's happening. And for the sewage samples in Fung Chek House, and since the samples tested positive again for, say, 2 to 3 days in a row, the Hong Kong U team has recommended that a second test be mandated. So this is what we're going to do, and we'll see whether new cases can be identified. Third, about the epidemic situation. Everyone wants the epidemic to be contained as soon as possible. We see a downward trend as shown by the figures, but we have to be very prudent. If we relax the measures too rapidly and people gather again, there is a high risk of a rebound. So we have to be very careful and in what we do. So the last question here. Apple Daily, 3 questions. First, about the Kai-Tak Command Center. Who is the head of the center? Will it be someone from the CHP or the discipline services? What rank will this person be in? And so, what is the anticipated operation period for this center? And then, for the cases today, the preliminary positive case at PMH, during the incubation period, has the patient visited blocks E and F? If yes, when? And for the KMB bus driver confirmed yesterday, does he have any close contacts who have been confirmed? If yes, what is the number? And third question for Dr. Yu. First question is about the environmental samples of PMH. A source told us that the medical officers' rest place is extensively contaminated. And the healthcare staff within the hospital are very bewildered by this piece of news. So what is the viral load of the environmental sample taken at the resting room of the medical officers? How contaminated is the environment? No doctor has been confirmed yet, but does the hospital have to do further investigation into the condition of the resting room? And also, Yu Weiming, head of the Doctors Alliance, and she was arrested. And what is your response to the first employee of XJ being arrested? Will the XJ provide, say, legal advice and other support to this staff if she can't attend work now? How would you treat her, I mean, in terms of salary payment and so on? For the command center in Kai-Tak, we hope that someone senior from the discipline services will serve as the chief in command. Of course, they are helping us out, and we would definitely support them in all they do. And for the bus company, the bus driver confirmed yesterday, his family members have been confirmed. So I will not I will not share with you the case numbers. We haven't had any definite plan yet. Dr. Yu, as for the preliminary positive case in PMH, the hospital has conducted investigation, and it has nothing to do with the medical day ward. Now, as to whether the colleague has visited EF blocks, I don't have the information on hand. Yesterday, I said that 6 environmental samples tested positive, and the CD value is about 30. The colleague might have gone into these places, so we can't rule out that the virus is still in some areas, and thorough cleansing and disinfection have been carried out in these areas. As for the case that you mentioned, I don't have the information, I can't comment, but the XJ does have our own established mechanism to handle such cases. Thank you very much.